Hello, my name is Dr. Neil C. Murphy. I have taught orthodontics at Loma Linda University, UCLA, the University of Southern California, Case Western Reserve University in Cleveland, Ohio, and even the University of Hong Kong. What I'm about to show you is a series of video vignettes that will demonstrate how we can manipulate safely the supporting tissue of teeth so that they respond better to orthodontic treatment. This makes standard orthodontic treatment for adults and children faster, safer, and better. So sit back, relax, and I hope you enjoy these videos. Thank you very much. Commence with the transmucosal perforations. Number 2, high-speed, long shank, round burr, and this demonstrates the amount of irrigation that we need with it. Copious irrigation is vital. Here you see the amount of crowding here. We have a heat-treated stainless steel coil spring, but it's not acting very rapidly at all. So we'll be doing a TMP here, here, and here to open up this space. Here we have an example of TMP. You see the little erythematous areas where it was done. That tissue is now osteopenic, and if we look down from the occlusal aspect, you see that it's pretty well aligned. We have some distal rotations that need to be done, but that was a Class 2, Division 2 malocclusion. We treated that in 2 weeks. Hello, my name is Dr. Neil C. Murphy. I am a periodontist and orthodontist in Los Angeles, California, and clinical professor at Case Western Reserve University in Cleveland, Ohio. What I'm about to show you is a series of videos that demonstrate how we can manipulate hard and soft tissue around the teeth that are in orthodontic therapy. I think you'll be interested in this. At this point, it's in clinical studies, and you'll notice that we can actually move teeth much faster than with traditional mechanotherapy. And this also avoids the infection and the possibility of extraction of healthy teeth. I hope you like it. Here we can see that the mobility is about a 3 on a 3. We can literally align the teeth in 1 second. Crooked, aligned. So-called arch length discrepancy, perfect alignment. This is the degree of mobility that we want without attachment loss. See that everything's well aligned except for the mandibular right lateral incisor and the mandibular central incisor. That central incisor will align up with the left central and lateral incisors in approximately 30 seconds. It's very important that we realize this mobility that we're seeing clinically has not affected the roots at all. It's a reasonable presumption that that much mobility seen clinically is caused by severe root resorption, but we see none here. Consequently, we must conclude scientifically and deductively that the mobility is due to the widening of the periodontal ligament space, which is minimal, as you can see here, but also the generalized, transient, reversible, induced therapeutic osteopenia. Now here we see in Miss M that the right lateral incisor is aligned. The slight rotation will equilibrate later. That's a remnant of the effect of the push coil. You see here we have about just about 1 millimeter of space, so we'll put an A-chain from here on this anchor unit to the mesial wings, and this should close that space in about a day or so. Something interesting has happened here. While we were waiting for Miss M to feel a little better from the adjustment of the elastic chain, the space closed, as you can see. So what we'll do now, since it's closed within literally 10 minutes instead of 2 days, we'll just tie it in with the ligature. What's notable about this case, the case of Miss M, is that the mobility that we saw, the physiologic mobility, really didn't come about until about the 3rd or 4th week after we placed the stop advance arch wire. Now normally we would not see this mobility had we not done the selective alveolar decortication. So by priming the alveolus bone with selective alveolar decortication, SAD, it responded in a much more exaggerated but normal way to the stop advance arch wire. The movement that we want, small circular motion under the brackets, we have about 5 pounds of force here. This is the treatment that we want for Miss M, and then of course we want to angle it in approximately as far as it'll go, and 45 degrees into the gingiva, a small circular motion. And you see this will elicit bleeding, but that's actually good. This bleeding is relieving venous congestion and getting rid of poisonous and toxin concentrations in the blood. So once this contaminated blood escapes, arterial blood with what I tell patients are killer cells and high concentrations of oxygen,